Good afternoon, everybody. Welcome to our media update that we are doing Monday, Wednesday, and Friday in Eau Claire to give everybody that's listening some more information about what's happening related to COVID-19, to give updates from the local and state level, and to answer questions that people have. We appreciate you joining us and sharing the information that you're receiving with the people that you're in connection with. We'll walk through status updates again at Wisconsin level as well as for Eau Claire County. We have Dale Peters here with us again, and he's going to share some really great information about how the Chippewa Valley Task Force is moving forward for economic recovery. And then we'll end again with questions. So today in Wisconsin, we now have 66,630 negative tests for COVID-19, 6,520 positive COVID-19 cases in the state, about 10% of the tests, an increase of 231 positive since yesterday. 1,489 hospitalizations, again about 23%, about a quarter of people with COVID-19 have been hospitalized in the state, and deaths are at 308, an increase of 8. Again, a difficult number to have impacting all of our communities. In the state, there are now 50 labs with more than 11,047 tests being able to be done in those labs. The goal for the state was 12,000 tests per week. So we are close to that goal. Again, while we have capacity at 12,000, clearly 12,000 tests a day are not yet being done for a whole variety of reasons. The state announced today some summary data about places where we are all doing at a local and state level, facility-based outbreak investigations. 187 facilities in Wisconsin do have outbreaks of some sort or another that have happened related to COVID-19, including long-term care facilities, workplaces, group housing facilities, and in healthcare. Those are the types of settings that are being gathered at a state level. While we don't yet have local data about this, we certainly are also focusing on those group settings as part of what is our critical work to stop the spread of disease. Any of those group settings have not only the potential of high-risk transmission because of the proximity of people, but also in many cases have people living in them that are at higher risk of getting very ill and dying. Critically important sectors to pay attention to. In Eau Claire County, we are now at 29 confirmed cases of COVID-19, an increase of 2 since yesterday. Our testing numbers are 1,949 individuals, Eau Claire County residents tested. Of those, 1,839 are negative and 82 are pending. We have, as you likely note, have been getting a steady increase in cases over time. Again, those people that are being tested and we are finding positive are remain at home when they are infectious. That's their isolation period. Of the people that we have tested and are positive, 20 of those cases of the 29 are considered no longer infectious, so they are considered recovered according to the state definition. And weekly, we will continue to provide that updated information. We are seeing that increase in cases. There is likely community spread happening in Eau Claire. We've talked a lot about the fact that with the Safer at Home order that our circles are small, so the investigation of contacts of those cases is less than once we start moving toward having more interaction in the community. Stopping the spread of this disease is critically important. Again, we don't have anybody that has immunity except those that have already had the disease. And we really appreciate the work people are doing to keep circles small, to keep the curve flattened, and slow the spread of disease. The governor's office has, as of yesterday, responded to the Supreme Court challenge that was brought forward. That response went forward yesterday. State healthcare and public health organizations did submit amicus briefs, so briefs that were in support of what the governor's office and the secretary's office is doing related to controlling the spread of the disease. That did include Eau Claire participation in those amicus briefs. I've worked in public health for more than 30 years in various states, and this is an unprecedented situation. The public health measures that we have to take are unprecedented because of this disease. It's tough, but what the governor is doing is the right step forward. We know progressively we will be opening up the community, opening up the economy. We also need to do that, but it needs to be in strategic and deliberate ways. So we can slow down and manage the disease. The plan the governor has put forward, we believe, is a stepwise approach to that. Also today, Executive Order number 34 took effect as of 8 a.m. We talked about that on Monday, but today was the start of that. This is part of turning the dial, as the governor uses that phrase, to progressively open our economy and open the community in ways that are safe. Again, that order included some additional opportunities for non-essential businesses to do curbside pickup of goods and animals. It included the ability to set up ways to do rental of recreational equipment. It included the opportunity to do self-service or auto wash car washes. And it put forward, again, clear expectations around doing that safely and effectively with the minimal number of people involved. The existing Safer at Home order remains in place and is critically important as we walk through this together. Again, the circles being as small as possible is what we are supporting and working on. When people are out doing those essential things that all of us need to do, including getting outside and exercising and going to the grocery store, physical distance continues to be our best strategy. We also encourage people in the community in those situations where they'll come in potential closer contact with others to consider using a face cloth. There's good information about that available on our website, as well as generally available on the state and federal sites as well. As of May 1, certain state parks that were closed are reopening. Those did not include state parks in this area that were closed, but additional state parks are open. There's some specific direction from the governor's office about the hours of state parks, as well as fees for all state parks. Again, if you are someone that enjoys our absolutely amazing state parks in this state, please make sure that you are checking their website and aware of the guidelines that are in existence because of COVID-19. We encourage people to use those parks in a safe and responsible way to prevent the spread of disease. Again, physical distance and going with your household are what we would expect people to be doing. Some additional local updates. We do have a new website starting today. It was launched right before I came upstairs. We encourage people to go. You still can get there at the coronavirus.echhealthdepartment.org through that link. We will soon have hopefully a short link to also get people there. It's a website that is more intuitive and easy to manage, and we hope and expect that people will enjoy that ability to grab information in an easier way. Certainly give us feedback on that. We want there to be one reliable spot for people in this community to go to get data, to get information, and to find answers to their questions. We continue to have the call center also available. That call center number is 715-831-7425. That call center is a place to go if you can't get your information at the website, and we have people there to answer questions. Additional local updates. I spoke on Monday about regional testing capacity increasing for a short amount of time using National Guard assets. We have our regional application to the National Guard has been approved. They are working through those locations and dates for, again, a one-day testing spree to get increased numbers of tests done of those that have symptoms in communities. So, for example, on Friday in Alma, there'll be a testing site there available for Wisconsin residents to go to get tests done. Similar locations will be available around the region. As soon as we have those, we'll make them very readily available to residents in Eau Claire. Again, this is an approved partnership with the National Guard. It is not a long-term testing strategy, but it is our short-term way to get some increased tests being done. It's an opportunity for those with mild symptoms to get tested so we know what the course of disease is in our part of the state. Again, symptoms may be very mild. We encourage people, and many of our recent cases had very mild symptoms. We encourage people that have a sore throat, have nausea, headache, diarrhea, body or muscle aches, chills, fatigue, vomiting, loss of taste or smell, and all those ones that we are regularly talking about, fever, cough, and shortness of breath. Any of those symptoms, to talk to your provider about getting tested quickly, and if you have those symptoms when we have this drive-through testing opportunity available, that you consider participating. So today we're fortunate to have Dale with us. He's going to be talking more about the Chippewa Valley Business Recovery Task Force. It's really important that we prevent disease, and you've heard me talk a lot about that issue. We also need to support our economy. Equally important is that we continue to have ways to support success with our economy as we walk through this challenging time and come out on the other side with a new normal. It's tough in a disaster like this. I think, again, none of us were prepared in advance to deal with it. And I'm thrilled that we have partnership in this community that is really stepping and leaning into coming up with ways to creatively and energetically work on how do we move forward in this environment. So Dale's here to share a little bit more, and after that, I'll come back and we will answer some questions. Thank you.
Thank you, Liska, and maybe just reinforce, if I don't have this right, but one other aspect of that testing that you were talking about, Liska, is that you do not have to have health insurance to participate in that health. So when this testing does take place in the regional basis that's being supported with the National Guard, it's not contingent on you having a specific healthcare provider or health insurance. So, and I'm sure we can build more on that, as it comes around. But just something to think about there. So, of course, we've been talking about COVID-19 and the challenges and stresses that it's been placing on us, and we've done a lot of work to keep our healthcare systems from being overwhelmed. We've done the physical distancing and the practices and the closures, and all these measures we know have saved lives and they have slowed the disease spread. But they've also taken a very significant impact on our economy, both at the national and the state level, and at our local level. And now it's time to think about, how do we reopen this economy in a way that minimizes the impact of disease, protects our employers, protects our employees, our residents, and our visitors. And how do we do that in a way that whole sectors of our economy can safely restart? Well, in Eau Claire, we are committed to using a strategic, data-driven approach so that we do not reopen the economy so quickly that it overwhelms our ability to contain disease or doesn't overwhelm the ability to contain the disease spread or our healthcare systems. And last week, we talked about the formation of a Chippewa Valley Economic Recovery Task Force. This is an effort to pull together some smart, talented, and motivated people in the Chippewa Valley that are working together, and they can find a path forward so that we can build on the strengths of collaboration and cooperation that we enjoy here in the Chippewa Valley. And I'd like to point out this is just for building up our entire region. It's not for building up just one municipality. So although I'm here and one of my roles is as the city manager for the city of Eau Claire, this is a regional effort to build up our entire region and not just one municipality. The formation of the Chippewa Valley COVID-19 Economic Recovery Task Force is pulling together all these resources and organizations and talent from all across the Chippewa Valley so that hopefully we can emerge from this crisis in an orderly, successful, safe, and stronger position. Today, in terms of an update, we can share with you that Mark Fanas and Greg Moore have agreed to be co-chairs. Mark is a retired CPA and has had leadership positions and roles with the Chamber of Commerce and is well connected with the business community. And Greg Moore was the former chair of the county board and very active in our community. So they have graciously offered to be co-chairs of this task force. We've also put together a coordinating team that helps Mark and Greg, and that is myself, Catherine Schaaf as the county administrator, Mike Golat, the administrator from the city of Altoona, and Lisa Giese, the director of the health department and incident commander. We've also established an advisory committee that will help guide this task force. And that advisory committee is made up of Scott Biederman, who is the current chair of the Chamber of Commerce, Phil Swanhorst, who's a representative of the Area Labor Council, Brendan Pratt, the mayor of Altoona, Terry Weld, the city council president, Nick Schmeier, the county board chair, Jeff Hallowan is a technical advisor, and we are still looking for, not quite confirmed, but we'll have some representation from the towns in our county also on that advisory council. The administrative support for the task force is going to be provided by the Chamber of Commerce and also the economic development staff at the City of Eau Claire. We have 4 branches in the task force, the first of which is Fiscal Assistance, and the Fiscal Assistance group is going to be providing information, business application assistance, and startup assistance to folks, businesses in the area. And that's going to be co-chaired by Luke Kempen, who works with the Small Business Development Center, and Ann Rumpnow, who is the heads up and takes care of the environmental program at UW Eau Claire. For promotions and communications are going to be co-chaired by Mike Rindo, a vice chancellor at the University of Wisconsin-Eau Claire, and Benny Anderson, who is works with Visit Eau Claire. And they're going to be working on not only communicating the business recovery work, but also community promotion and development there. One of the larger sections of the task force is the business sector recovery planning. And there the co-chairs are going to be Aaron White, who is the economic development manager for the city of Eau Claire, Dave Miner, who's the CEO of the Chamber of Commerce, and Luke Hansen, who's the executive director of the Eau Claire Area Economic Development Corporation, and Marissa Stanley from the health department, and who's also the operations manager for the incident. Those are all going to be working together to have a coordinated response to the various sectors that we're going to be working with. 2 things are going to happen within the sectors. First, a very hopefully coordinated process for getting health information to the business sectors and a flow of information to and from the health professionals to those sectors, and also a focus on how does that sector actually recover and what are some things that business sector can do to recover effectively. We've developed various sectors. Ag and rural is very important. We recognize that in this county, it's not all urban, but there's a significant component of ag and rural economic development that contributes to our economic vitality, so that's a sector. We also have sectors for construction, entertainment and amusement, manufacturing, outdoor recreation, spaces and gathering, professional services, real estate, restaurants and bars, retail services, transportation, hospitality, medical and health, school and education, vulnerable populations, religion and government. Whew, that's a lot. But there's a lot of economic activity in the Chippewa Valley, and we're taking these unique sectors and carving them out, and we're going to be having people step forward to help out with that sector recovery. The 4th branch in the task force is the employer-employee exchange, and Scott Hodek with the WEDC is going to be heading up that work. So a lot of commitments from these people, and there are many, many more roles that need to be filled. So far, the task force has developed objectives and deliverables. We have taken and put together some guiding principles. There is a website that is currently being designed and will go live in conjunction and be part of the website that was just announced by Liska. And every good initiative needs a logo, and we have developed a logo as well. So the task force is gaining energy as a community-wide collaborative effort to take a measured, coordinated, and safe path forward to our economic recovery. The rules and restrictions and guidance for moving forward, as you know, are constantly changing, and one of our challenges is communicating those changes. And as one would expect this to happen, it's a dynamic situation, and all of us are learning every day. And that's why it's important that we use data and that we be strategic with our community partners to provide a consistent and coordinated response. It's important that we follow the recommendations of our health professionals. And it's important to understand that this is not going to be easy, and it's going to be challenging to coordinate, because there is not going to be any one perfect way to do this. There is, however, a path forward, and that is that if we remember that everyone that's involved with this economic recovery is coming at it from a different place. All of us are going through this crisis from a different place and have different perspectives, different needs, different wants. We all have fears, we all have concerns, and we all have worries. We all fear that we might get sick ourselves. We fear that our loved ones might get sick. We worry about the capacity of the systems to handle the situation. We worry that all the people that are on the front lines in our hospitals, in our stores, in our police, and our fire, our water, and our 911. We worry about our own mental health, and we worry about the mental health of others that are facing these brand new challenges and stresses. And of course, we all worry about our jobs and our economic security. So as we navigate this path forward, I think it's important that we have grace and compassion for one another, that we treat each other with respect. We need to acknowledge that everyone is doing the very best that they can in this situation, and that kindness and compassion are far more helpful than criticism and complaints, and that we need to each in our own way find ways to contribute that pull everyone forward. In this time of uncertainty, it's been energizing, really energizing for me to see the passion and the dedication and the commitment of the people that are stepping up to move Eau Claire forward in a civil, constructive, and positive way. It gives me great hope that we will emerge from this as a strong and cohesive community of people that support and take care of one another.
Thank you, Dale. I just want to close by saying again, there are some things we are in control of with this kind of a pandemic. Some things are difficult in this kind of pandemic, but I think we can control our attitude, and that's something we've talked about before. We can also lean into our really strong ethic in this community of doing the right thing and partnering. And we really have that in Eau Claire. We're fortunate to have it, I think, demonstrated by what Dale just shared with you. All of you can do that leaning in by supporting having good information available for people in the community, by modeling the right way to walk forward to protect yourself and to protect others and those people in your family to prevent the transmission of disease. And by stepping forward to help in big and small ways. Volunteer to be part of things like the Chippewa Valley Task Force. Step in to say yes when you are asked to help support the next step in our moving forward. Again, our website, a place for you to get more information, coronavirus.ecehealthdepartment.org is the quickest way right now to get to that website. We will make sure that additional pathways to get there are available soon. That site will have information not only about how we are responding in incident command to COVID-19, but also data and information about the Chippewa Valley Economic Recovery Task Force. So a great place to stop and get what you need to learn more. We will continue with the Monday, Wednesday, Friday schedule with our updates with the media. So we'll be back on Friday unless something significant happens between now and then. And now Dale and I are available for questions. Yes?
You said that there is likely community spread happening in Eau Claire. So I know that, can you elaborate on that?
Sure. So the question is, there's likely community spread happening in Eau Claire. Like we've said over the last couple of weeks, most of our cases we can track back, especially in the beginning, related to travel or a contact with a case. The more recent cases that we've been having, it is clear that it's a bit more difficult to pin it on, yes, they were traveling in a very high incident state recently because most people are staying closer to home, or that there was a positive case that was directly connected to them. So while it is difficult always to say community transmission is happening, it appears that that is likely and is absolutely not a surprise to us. We've been indicating that in Wisconsin for many weeks now, and it's not a surprise that that is also true in this community. Yes?
Bouncing off of that community spread, folks in Madison have been told, there's high community spread here. You should assume that when you go outside, you may come into contact with this. Is there anything different that folks in Eau Claire County should know now that, there's community spread?
So the question is, should people in Eau Claire be doing anything differently now that, again, the general sense for many weeks has been that there is likely community spread in this community? This is a disease that has a very high proportion of people with no or limited symptoms, symptoms that really, if it wasn't for this happening right now, most of us would frankly ignore. We would go about our daily lives. The symptoms in very many cases are very minimal. It's why the assumption is there that for a long time now that there's likely community cases that have not been tested, people have not been concerned and not gotten extremely ill. Because of Safer at Home, the circle of spread has been small, so the percentage of people that again, potentially could be impacted and get serious disease and be hospitalized is minimal. We've had hospitalized cases. There are serious cases across Wisconsin, but really, in the end, a simple answer to the question about Eau Claire residents is that people need to maintain physical distance. That's your best way to stop the spread of disease. Keep your circle small. Stay with your household. When you're outside, a cloth face covering if you're coming in contact with individuals in a close way, or you may come in contact with individuals in a close way, is recommended by the CDC and the state. There is nothing new as of today that we recommend to the general public.
Question for Dale?
Yeah.
So, if memory serves, I thought that your time as the city manager was going to wrap up in May. So it seems like COVID, has COVID affected your thinking on that, and where does that sit in terms of you extending your tenure as the city manager?
Sure. So last month I announced that I would delay my retirement to roughly around 45 days after the end of the emergencies. Frankly, I still would like to retire, but I want to look for the situation to have stabilized, and just know that things are stabilized before before having that transition within the organization.
For Dale?
No, for you.
Yes.
So, personal anecdotal story, not me, but there was a shopper. I was at Walmart yesterday. It was a rainy time. They apparently have some structure kind of for people to come through. This particular shopper, consumer, tells me that because of the rain, they went through a different door. They were confronted and told that you can't do that because if you do, the city county health department's going to shut us down. So, just curious, is that accurate, or how should people understand that?
Sure. So the question is related to those businesses that are open in the community. How are we looking at making sure that we are keeping people safe and healthy, both the employees and the people entering those establishments? There's a lot of work happening to educate those work sites, all kinds of work sites now that are open to the public, to make sure that they are having physical distancing, to make sure that they are using the guidelines in the Safer at Home order around the number of people in their facility at a time based on their square footage, making sure that their employees are monitoring their symptoms and not working if they are ill. So there are very clear guidelines in place for all of those businesses. There's very clear education happening. And certainly, if there are complaints from the public, we follow up on that and follow up with that organization and talk it through with them to make sure that they are doing the things that they need to do to assure all of our health and safety.
You said that you did an amicus brief, if I understood you correctly, supporting the Evers administration's response to the Republican lawsuit. So are you familiar at all with the plan put forward by the Wisconsin Manufacturers of Commerce on Friday, calling, I believe, for a May 11th opening, and do you have any reaction to that?
Sure. So the question is related to the various plans that are out there related to reopening our economy and reopening the state. Wisconsin Manufacturers and Commerce plan was the specific one talked about. Yes, I am very familiar with that plan, and most local health department directors and those doing incident command across the state are very familiar. It is a plan that is being talked about with the governor's office as well. All the plans that are being put forward by various entities have strengths and weaknesses to them, and we are certainly looking at that as part of how we are approaching communicating about the next steps forward. No date certain plan makes sense, including any of the plans. We really need to look at the progression of disease, and the virus itself sets our time frame, not any date in the calendar. We all want that. I would say we all need that because we need people to stay healthy and keep that curve flattened. The worst thing that could happen in the state is that we just arbitrarily set a date and then we have disease spread that is not manageable. I think all of us want our loved ones to get to a hospital where they are able to receive the care they need if they are one of the percentage of people that will need that. And if we have a lot of people getting sick at the same time, and we've seen that in other places that have opened up too quickly and too expansively and not done it progressively and slowly and strategically, I think none of us wants a situation where we can't manage that disease and illness. We know people will get sick. Yes?
New York Times columnist Thomas Friedman wrote what I thought is an outstanding piece in today's New York Times. It's called Is Sweden Doing It Right? But I just wanted to get to herd immunity. He says, after all, herd immunity is our goal, either from vaccination or from enough people building natural immunity. He says those are the only ways to achieve it. At the end of his piece, he quotes Dr. David Katz, March 20th editorial in the Times that said, herd immunity has historically been nature's way of ending pandemics. So my question is, when and how can we go from flatten the curve, because we don't want to overburden medical facilities, to where we're openly talking about herd immunity?
Okay. So the question is really related to herd immunity, which has been in the national press as well as the state press regularly. Herd immunity is a concept in public health that if a high enough percentage of the population has a disease or has had the disease or has been vaccinated against the disease, that then the likelihood of pandemic or broad spread, urgent spread, is less. So it's one of the strategies that we use with vaccinating individuals is we want to get to a certain percent so that we don't have widespread disease transmission happening in any given community. In a pandemic situation, either a vaccine or getting at least above 70% herd immunity is seen as probably our best next steps to make sure that we don't have broad transmission happening. We won't have a vaccine for a while. The question is related to what then happens with that the herd immunity idea. We certainly are slowly and strategically and progressively trying to get to herd immunity in this state and across the U.S. and internationally. The challenge with this disease is that it is very infectious, and so if we open up too far, many people will get ill at the same time. The flatten the curve mantra that all of us have been hearing is exactly about that. We know people will get sick. We know people will get ill. when they are exposed to this disease. We want the fewest number of people at the same time getting sick. So we will build herd immunity over a longer period of time if we do this right. And the people that do get sick will be much more likely to be able to access the health care that they desperately need during that time if we don't have an overwhelmed healthcare system. So the idea of herd immunity is exactly right. The editorial that you quote is right. We need to get there. Doing it strategically, doing it smartly is the next step in the process. The order that came out last week that is now in place does progressively open up our communities and our society. Step by step, I anticipate we will be doing that over the next number of weeks and months. And I think a smart approach is our safest and best approach for all of us, for me, for my family, for everybody in this community. Wonderful. Thanks everybody again for participating. We'll be back on Friday and look forward to giving you an update. Please do not hesitate to go to our website and call the COVID hotline if you have additional questions. Again, 715-831-7425. Thank you.